Hey everyone, so today I'm going to be doing a training on how to align clinical theory alongside Essential Soul Care Oracle cards. This is very exciting for me because this is something I just absolutely love to do. I love to bring awareness to the similarities between spiritual theories and clinical theories and how we can create a bridge and merge these two worlds instead of the message of keeping them so separate. Okay. So just a quick introduction of myself. My name is Dr. Tina Vitolo. I'm a licensed clinical social worker, and I have my doctorate in social work. I feel like I've been a social worker for like 100 years, but apparently it's only been 20. And I recently got my doctorate from Florida Atlantic University, and I got to research a topic I love, which is complementary and alternative interventions in clinical social work practice. I am so passionate about this because as a practitioner, I have felt so isolated in the field with not having access to more innovative therapists who understand the benefits of Eastern medicine, that understand the impact that spirituality can have in practice. And I'm loving that research is building around this area. And as someone who used to deal with pretty extreme anxiety in my life, I have to say that I wish that my clinical practitioners could have had a better understanding of my spiritual journey versus having me keep these two worlds so segregated. So, I am an expert in building clinical language around unconventional practices, but I'm also an expert in building competency on the merge of unconventional practices so that therapists can stay within scope of practice and move in integrity when integrating these types of practices into their clinical practice with clients. I am an absolute research junkie. I can't believe I'm admitting that now, but I have so much research on multiple types of modalities that would be considered non-evident or non-empirically supported, but the research is coming. And outside of focusing on that, I also love to research the understanding of where we are as a profession. And right now I'm doing a deep dive into all of the state boards, looking at their scope of practice so that we can make sure that we're moving ethically and within regulatory guidelines as we are integrating these more unconventional practices in the mental health world. I am the founder of the Black Sheep Therapist Innovative Practitioner Accelerator Program. This is a program that is literally the A to Z of everything you could possibly need to build a professional life of freedom, integrating the practices that you know and love and also impact more lives. So I teach a ton on building an integrative clinical practice framework, how to identify your ideal client, merging non-traditional practices, building the verbiage around it, helping you build a transparent, informed consent so that you can protect your license, you can protect your clients, and you can move with integrity in being able to merge the skill sets and the passions that you have into mental health practice. My Facebook group has grown so much since I launched it. And right now we have over 1,300 unconventional mental health therapists, just like you, who love learning about how to merge different modalities into their work. So there's a ton of free guides, a ton of free trainings, and I'll give you more information on where you can get that at the end of this training. So let's jump in. So I just kind of want to go over the agenda for today. So I'm just going to do a quick review on staying within scope of practice when using unconventional modalities. Then we're going to do a review of Essential Soul Care's fundamental beliefs for creation and application. I'm going to be highlighting clinical theories along the way that merge with those kind of fundamental beliefs. But then I'm also going to be highlighting clinical theories in the use of oracle cards in general. Then I'm going to talk to you about how you can merge the Essential Soul Care Oracle deck in your psychotherapy sessions, going through a quick case example, and then I will also do a quick review. Okay, So this is what I love to teach. I'm not going to be going through all of the components, but I'm mainly going to go through the ones that we're going to focus on today. So if you are looking to remain within scope of practice, which I believe everyone should, there's integrity behind this when you're merging unconventional practices that maybe haven't been vigorously researched like others. But my favorite thing about non-traditional and spiritual practices is that you can put your own spin on it. You don't have to be so rigid, but there are some things you really want to keep in mind when you are bringing these modalities into your practice. Number one, the modalities have to align with clinical theory. And that's going to take some work on your part, depending which clinical theories influence your work. So the reason I put this as number one is that in my research with all of the scopes of practice, the one thing you'll see across all of the state boards is that you need to be using modalities that align with clinical theory. That's so far I haven't come across one that says that that's not there. Now, I don't see, at least not yet, a explicit statement saying that you have to use empirically supported treatment modalities and that you have to use an evidence-based framework, even though I do feel like following an evidence-based framework is very good. So that's why I believe to remain within scope of practice, you should be using an evidence-based framework. Now, most people get this confused, so I just want to review this with you really quickly. This has to do with the research that is available. It doesn't mean they're RCTs or it doesn't mean they're systematic reviews, but are you doing your due diligence to see the impact of these types of interventions in clinical practice or for mental well-being? What is your clinical expertise? That's the second part of evidence-based practice. Have you gotten training on the things you're bringing into these psychotherapy sessions? And also, what are your clients' preferences and values? All three of these have to coexist in order for you to be using an evidence-based framework. Then you have to identify the underlying themes within empirically supported modalities and non-traditional practices. So like you got to highlight that correlation and that connection. And you have to use the unconventional modality in a complementary way to clinical practice. So there has to be a fusion, not an either or. So it's kind of a both and perspective, not, oh, we're going to do oracle card reading today, and then tomorrow we're going to focus on psychotherapy. No, in order to remain within scope of practice, we have to be able to bridge these unconventional practices into the therapeutic space. It's also important for you to identify potential risks and list your clinical and non-clinical training, as well as build transparency in your informed consent. This is really, really going to be important. So these are things that I teach in my program, but today we're just going to kind of go along like creating that connection, highlighting the theories, just so you can get an idea of how maybe you can do this with other modalities that you're using outside of Essential Soul Care, or maybe there's other oracle decks that you like to use. I have about, what is that? Like 10 oracle decks to the right of me. All right, so let's just get into what is Essential Soul Care. Okay, so what I really appreciated about what DeeAnna and Madison did is that they really highlighted the fundamental beliefs in their oracle deck. Now, I know most people probably opened up the oracle deck, they're just, jumping to pulling the cards and how to do that, but I went directly here because for me, understanding the why is so important. That's why I love clinical theory, because clinical theory allows us to understand why we're looking at something a certain way. It helps me understand the purpose. It helps me understand how change happens. And to me, I like to believe that these 7 elements and these 7 chakras are kind of like the spiritual theory behind why this card deck is so special and what should really be at the forefront of your mind when you're integrating it. And I think this is important for any modality that you're bringing into the table. So I'm just going to show you how I looked at these elements and the chakras and how I've aligned them with some clinical theories. And you'll see them, I believe that's like right in the beginning. You'll be able to see all of these there as well. Okay, So transcendence. So this has to do with connecting with something greater than yourself, whether that's going to be through spirituality, nature, or just an overall sense of purpose. So this is going to involve practices that elevate one's consciousness and fosters a sense of peace and unity. Now, I'm not going to go through every single clinical theory that I put here, but I am going to go through a few. Some of them do repeat themselves. But I want you to think about that. Based on what I just said about transcendence, I want to review transpersonal psychology. So transpersonal psychology focuses on spiritual aspects of the human experience, including those metaphysical experiences, peak experiences, and the quest for meaning beyond the individual self. Do you see how much that correlates with the definition of transcendence and how it's used in this card deck? And if we even look at existential psychology, this perspective is going to emphasize finding meaning and the purpose in life. It's going to often address questions of existence, death, and the human condition. So there is an absolute correlation between the spiritual theory of transcendence and the clinical theories of transpersonal psychology and existential psychology. Now, if we get into intuition, this has to do with trusting and honing your inner guidance, right? So this is going to involve listening to your inner voice and developing that deep sense of knowing that isn't solely based on your rational thought. Now, this really aligns with humanistic psychology as well as Carl Jung's theory as well. So in humanistic psychology, this really emphasizes personal growth and self-actualization. It's going to encourage an individual to trust their inner experience and their intuition. Same thing, we're talking the same exact language. Now, Carl Jung placed a lot of emphasis on intuition as a function of the psyche. He highlighted the role in personal development and individuation. So you can see we are talking about the same thing here. Now, when it comes to nourishment, this is going to have to do with, caring for your body through proper nutrition, hydration, all of those pieces. And this is going to include having a balanced diet, excuse me, and understanding your body's needs and fostering a healthy relationship with food. Now, you're going to see that both in health psychology and positive psychology. So in health psychology, the biological, the psychological, the social factors are going to affect health and wellness. And in positive psychology, this is going to advocate for a holistic approach to your well-being, which is going to include physical health as a foundation for overall happiness and life satisfaction. We are all speaking the same exact language here. All right. So mindset is going to focus on cultivating a positive and growth-oriented mental attitude. Now, this is going to involve any type of practice. Oh, sorry, I feel like I'm going to sneeze. Sorry, okay. That's going to promote and enhance mental resilience, such as positive thinking, mindfulness, and cognitive restructuring. Now, you can already see how that aligns with CBT, right? And the components behind that. Because if we have a positive mindset, we're able to kind of create what life looks like for us. So very, very much, again, we are all saying the same thing. Now, if we look at community, community is about building and maintaining supportive relationships and a sense of belonging. And this is going to involve connecting with others, contributing to your own community, and fostering those strong social bonds. So in social psychology, this is going to study how social interactions and relationships impact mental health and behavior, emphasizing the importance of belonging to a social group. And authenticity in relationships, you're also going to see that a lot in existential psychology. Now, if we look at creativity, this is going to have to do with engaging in activities that express your uniqueness. I'm all about us expressing our uniqueness. And this is going to allow artistic pursuits to exist, and problem solving and innovation and thinking that really fosters personal expression and joy. So in humanistic psychology, that whole theory focuses on values and creative expression as a means of self-actualization and personal growth. So it's recognizing its therapeutic potential in creativity. So again, we are speaking the same exact language. And again, I will never understand why there's such this break between these two worlds, because we are literally saying the same thing. And when we look at sanctuary, creating a safe and nurturing space, both physically and mentally, this is going to involve having places where you feel secure and at peace. When I was learning about neuroscience, because I was kind of like a neuroscience buff for a little bit, I remember hearing that the brain was not able to make changes unless it felt safe. I'll never kind of forget that. But think about it. The therapeutic relationship needs to feel safe. If it doesn't feel safe, no change is happening because our brain is not going to allow us to. So it's really important to have places where you feel secure and at peace. And in environmental psychology, that's very much what it examines. It looks at the impact of physical environments on your well-being and supporting the idea that a nurturing and safe space is going to, enhance your overall mental health. So everything's the same. I know you probably didn't think you were going to get all this information today on this, but I'm really honing in on it because we need to understand the fundamental beliefs, and we are all speaking the same language. This is not woo-woo. This is just a new way of another way. It's not new. In fact, this was probably out way before any of the psychological theories were out. But I want you to understand, if you're ever questioning your integrity with integrating these, or you feel like you're someone who needs to hide using these modalities, don't. We are all speaking the same language, but it's up to us to know what that is so that we can speak to it with not just our clients, but with our colleagues too. Okay, so the concepts of chakras is going to originate from Eastern traditions, of course, and there are ways to interpret their functions and significance within the framework of modern clinical psychology, which is what we're going to do here today. I have my notes as I'm going through this, make sure I'm not missing anything. All right, so if we start with the root chakra, when we have imbalances within our root chakra, we're going to feel that fear, anxiety, insecurity, financial instability, like really you're not going to feel connected or grounded. So I'm not going to go through all of the different theories, but I am going to, again, go through a few. But if we look at attachment theory, the root chakra focuses on security, stability, and the survival of needs. This is going to align with attachment theory because attachment theory emphasizes the importance of secure attachments in early childhood and healthy emotional development. So there is a correlation there. Now let's look at the sacral chakra. So when we have imbalances in our sacral chakra, this is going to lead to emotional instability, fear of change. It could be, sexual dysfunctions, depressions, issues with our reproductive system, things like that. So if we look at connecting this to, let's just say, an object relations theory, if the sacral chakra's emphasis on emotions and creativity, excuse me, I feel like I'm going to sneeze again. So sorry. And relationships resonates with object relations, which explores how early relationships shapes one's sense of self and capacity for intimacy. So object relations is looking at that the same way that your sacral chakra is going to look at emphasizing on those emotions and creativities in those relationships as well. So there is a correlation there. Now, if you want to look at this chakra in association with sexuality and pleasure, it can also reflect aspects of Freud's psychosexual stages of development as well. So it's just going to take some time to really look into these and see how these can correlate with each other and where that alignment is. So now if we're looking at the solar plexus, which is my chakra, that's always out of whack, that I always need to give a lot of attention and space to. When we have imbalances with this, that's going to lead for us to have like low self-esteem, a lack of control, anger, things like that. And we can really see a correlation with the self-efficacy theory because the solar plexus chakra is going to focus on personal power, confidence, and self-esteem. And this relates to Bandura's theory of self-efficacy, which is going to emphasize an individual's belief in their ability to accomplish tasks and achieve goals, basically promoting their self-worth. Hope this is all resonating with you guys well. I wish this was live so I can ask you guys questions, but you're not here. So when we get into the heart chakra, one of my favorites, when we have imbalances here, again, we're going to be experiencing grief, anger, jealousy, fear, betrayal, feelings of abandonment, things like that. And the heart chakra's emphasis on love and compassion and forgiveness is going to align with interpersonal theory, which explores the impact of social relationships on mental health and well-being. Also, healing imbalances in the heart chakra, such as unresolved grief or relationship difficulties, can be addressed through attachment-based therapies that are going to focus on repairing relational wounds and fostering those secure attachments. See, all of this same focus, these theories, in fact, if I was to say it, I would probably say these clinical theories were based off these ways of life, this energetic understanding, before we were even able to make sense of it. This was already in existence. So we're kind of, I like to say that we're using innovative practices, but in fact, we're really going back to baseline practices. All right, so let's get into the throat chakra, all about communication, expression, and truth. Now, when we have imbalances in this, you're going to see problems with communication, fear of speaking, dishonesty, and issues with the throat, neck, thyroid, and ears. So you're going to see the correlation with communication theory because the throat chakra's focus on communication and expression and truth is going to align with theories of effective communication, which emphasizes the importance of clear, honest, and assertive communication in healthy relationships. Okay. 2 more to go on the chakras, and then we're going to get into some more fun stuff on clinical theory. I bet you've never had this much clinical theory thrown at you before, but it's something I just absolutely love, and I keep looking at my notes, so I want to make sure I'm not missing anything when I'm going through these. All right, so if we look at the third eye, our intuition, perception, imagination, and wisdom. Now, when we have imbalances in our third eye, that's going to be a lack of intuition, difficulty concentrating, sometimes nightmares, headaches, and we can really see a correlation with both cognitive psychology and mindfulness-based therapies. So in cognitive psychology, this explores how mental processes such as perception, memory, and problem solving influences behaviors and experiences, which can really correlate with the third eye chakra's emphasis on intuition, perception, and imagination, right? Now, practices that cultivate mindfulness and present moment awareness can help individuals connect with the intuitive wisdom of the third eye chakra and develop insights into their thoughts and also emotions. Now, the crown chakra. When we have imbalances here, this is going to lead to spiritual disconnection, questioning our purpose, confusion, depression. It's going to have issues with the nervous system, all of those things. And in transpersonal psychology, we can look at it this way. The crown chakra's focus on spiritual connection, enlightenment, and just overall awareness is going to resonate with transpersonal psychology, which explores experiences of transcending the individual ego and connecting with your higher state of consciousness and overall purpose. Okay, so all of these are correlated, and I want you to see that. Because sometimes when we start talking about the chakras and things like that, the response is always like, oh, that's that woo-woo stuff. No, it's built off a fundamental belief system and where we need to prioritize our focus so that we can have accelerated health and healing and move in flow versus resistance. Okay, so here's the fun thing. I'm going to go over 4 different theories, which I'm sure you're all aware of. But I wanted to go through all 4 of them because I want you to understand how you can kind of tweak your engagement of your oracle cards. Well, not tweak your engagement, but really think about how you use the oracle cards, because all of you are going to use these a little bit differently. I haven't come across one psychic intuitive that uses them the same way. I don't know anyone who uses oracle cards the same way I do, but I want you to understand the different ways that they connect to clinical theory. And depending on how you use them, maybe which one of these you maybe will resonate with more. So if we look at Jungian psychology, we're going to look at these three different areas: the archetype imagery, the synchronicity, and then the shadow work. So we all know that Carl Jung emphasizes the significance of symbols and archetypes in that unconscious. And a lot of the oracle cards are going to have this symbolic imagery that can tap into those archetype patterns and to provide insight into the deeper layers of the psyche. And when it comes to synchronicity, which is one of my favorite concepts, the meaningful coincidences of events, which suggests that external phenomenon can reflect internal states, is just awesome. So like, even for myself, or even in your own practice with oracle cards, you've probably like popped a card out and been like, oh, it's maybe the third or fourth time I've seen that, and I love that, because it just makes you feel like you're a part of something just so much more, right? It's going to draw a mirror to your inner thoughts, feelings, experiences, like, well, what if? I think synchronicity is just so powerful, and I love the use in oracle cards. Now, Jungian also emphasizes the importance of integrating the shadow, the unconscious aspects of the personality that are going to be often repressed or denied. So this can be a wonderful opportunity to use the cards for some insight, depending on maybe what kind of questions you're asking when you're pulling those cards. What's nice about these cards is that there's so many different reflections to have along with the workbook for more self-exploration and integration. Just going to take a drink here really quickly. Okay, so let's get into transpersonal psychology. Bless the world for transpersonal psychology. So the three highlighted areas are kind of like the main pieces of transpersonal psychology. It's like connection to those higher states of consciousness beyond that individual ego. It allows for mystical moments and spiritual awakening to actually exist. And oracle cards can absolutely be used to access and explore these higher states of consciousness, offering guidance and insight from a transpersonal perspective. Sometimes when I've used cards, like before I even decide that I'm going to be pulling a card, I'll actually use the card to ask if I'm in the right mind state, or am I connected enough to actually pull the card. And I'll know which cards those are, because those are usually the ones related to the chakras that'll kind of come up. But as you build a relationship with these cards, sometimes you can even use them as like a check-in, and I love that. Another way is through connection to the divine. So transpersonal psychology is can be seen in using the oracle cards as a channel for connecting to the divine or accessing spiritual wisdom or guidance. Sometimes I've been sitting with something, I've been struggling with something, and I'm just like, I just need to know if this is, am I on the right path here? Like, is there anything else I need to consider? And there's something just so magical. And I mean, you guys all know this, I'm sure, but pulling those cards and being able to feel like you're really connected. And sometimes, like, I've even used it in sessions and I'm like, man, I really am connected. Like, it actually gives me validation that like I've been doing the work, I'm doing the grounding, and I'm really just feeling spirit. I'm feeling the connection. It's beautiful. Transpersonal theory also emphasizes personal transformation and evolution as individuals move towards higher levels of consciousness. So you can use oracle cards to support this process by providing guidance, encouragement, and affirmations along the spiritual journey. I have a deck also on my phone, and every now and then I'll just pull it out and I'm like, okay, we're good. It's almost, yeah, it's just kind of like having spirit in your pocket, and I love it. All right. Existential theory. So existential theory has to do with meaning making, freedom and responsibility, and authenticity and self-expression. I feel like most of us who are intuitive clinicians, we really tend to lean towards existential theory because it's been something that we've gone through in our own personal experience. So You can see how oracle cards can help individuals explore existential questions and dilemmas, can provide insight into their values, aspirations, and existential concerns. Additionally, you're going to see how you can use oracle cards to empower individuals to take ownership of their lives and make choices aligned with their authentic self. So, when you're teaching the utilization of oracle cards, it's going to be really important for you to also understand your own relationship with the cards so that you can teach your clients how to build their own relationship with their cards too. I've always come across frustration when I'm trying to do it like somebody else, but that's not really going to allow me to feel free and have, my own responsibility with these cards, right? So it's about being open to creating that connection and relationship with the oracle deck, or the tarot cards, whatever you're using, and being able to support your clients and also building um, that relationship with the cards themselves so they feel like they're connected to it and not needing to rely on, you to pull the cards or only able to do it when you're modeling, things like that. And existential psychology also encourages individuals to live authentically and be vulnerable and expressive. So oracle cards can facilitate this by providing opportunities for self-expression, creativity, explorations of one true identity. There are so many different ways that you can do this. I'm going to go through a case example in a little bit, but what I love about this is like you can really make this look and feel any way you want to when it comes to the cards. I tend to be like an overthinker, so I have a contract with Spirit that they will pop the cards out when I'm using them. Instead of me having to pull, we have that understanding. So it really allows like just all pieces of myself to truly exist when I'm using cards. So this is how it aligns with existential theory. And now we get into psychodynamic theory. I think using the oracle cards as a projection tool is amazing. And we're also going to get into that in just a second when I go through the example. But psychodynamic theory suggests that individuals can project their unconscious thoughts, feelings, and desires onto external objects or symbols. And you'll see that when it comes to the use of oracle cards, where you can use them as a projection tool to kind of be curious of their unconscious mind based on the images, symbols depicted on the card. Psychodynamic theory also emphasizes the role of the unconscious mind in shaping behaviors and experiences. So oracle cards can serve as a beautiful medium for accessing and exploring unconscious dynamics, gaining insight into the self, or maybe the question you don't want to ask, or the one that your ego is blocking. And also symbolism and meaning. So psychodynamic theory is going to acknowledge the significance of symbolism and metaphor in the unconscious. So oracle cards, they have rich imagery, they have symbolic content, and they can evoke deep-seated emotions, memories, and associations, providing a window into the unconscious mind. So really kind of pulling in those pieces that you didn't even know were there. All right. So in terms of the practical application, I'm actually going to be giving you an example of how to use the cards as a projection tool. But like I said, like we went over Jungian psychology, existential theory, and transpersonal practices. So I want you to get creative with however you want to use these cards or any other cards for that matter. You can combine these techniques. You can keep them separate. I would say like whatever you do decide to use, do what feels good for you. As long as it feels good for you and it's something that you've already been personally using, I'm telling you, you won't feel like you're messing up. It just needs to feel aligned. It needs to feel good. So if you're wanting to take more of a Jungian approach, you can use the cards for active imagination exercises, have clients visualize and interact with archetypes and symbols that appear in the reading. If you want to take more of an existential approach, you can integrate existential questioning during readings to explore clients' sense of purpose and authenticity. And if you want to focus more on transpersonal practices, you can incorporate the use of the essential oils, crystals, and chakra focused meditations to enhance the spiritual dimensions of the reading. But let's get into the example. Okay. Hope my moving my little head around here on the screen. I'm not sure if you guys can see that. So when I was pulling a card for where I needed to focus my attention for this training, this is the card I got, the number 9, the Take It In card. Now you're going to see in the Oracle deck, on the card, and in the book, this is all of the information that is listed there. So I know I just said it before, but I really, really want to emphasize this. You need to make yourself familiar with these cards before you ever use them in psychotherapy. I promise my clients that I will never bring anything into session that I do not personally use. So I really want you to build authenticity and genuineness in your practice and use the cards. That's why I pulled a card for this training, because I didn't want to just pick one. I just wanted to see, okay, like where should I focus my attention? And this is the one that came up. All focused on like intuition, clairvoyance, and drawing in source energy. That really resonated with me. I also love that these cards have, recommendations for enhancements like essential oils, which crystals, chakra mantra. I keep getting that wrong when I say it out loud. Affirmations that you can use, and also journal prompts. Like, it is kind of a one-stop shop for you in case you're like, well, how can I expand on this a little bit more? This is exactly how you can. So I love it. Oop. All right. My little head again. So let's just talk about how you can integrate this into a psychotherapy session, how you connect it with goals, things like that. Now, this is just a like thrown together process. Please work on making it your absolute own. So if you start with the introduction, you're going to want to explain to the client that the card will be used to help project and explore, or depending on the different theories that you end up choosing, however other way you want to integrate the cards into the session. So you're going to tell them it's going to be used to project and explore their inner thoughts and feelings. So briefly describe the card's elements and its focus on intuition and the third eye chakra. Now, everyone's got their own way. Some people are like, no one's ever allowed to touch my cards. Some people are totally fine with it. So again, that really has to do with, your personal preference. So let's just say number 9 is chosen, and this is what we are going to have them focus on. Look at the imagery, look at the colors, look at the symbols, and really encourage them to take a few moments to just observe the card closely. Then I want you to ask the client to describe what they see in the card. You want to encourage them to speak freely about any thoughts, feelings, or images that come to mind, because this step is really going to allow the client to project their inner experiences onto the card. And that's where you want to be really focused on being an observer and picking up on things. Now, if you need some guidance, you can ask things like, what stands out to you in this card? How do the colors, imagery make you feel? What do you think the white light represents? How do you relate to the concept of drawing in source energy? Like, what does that mean to you? Okay. Now you can deepen the projection by exploring the card's message and focus areas. So you can use the book, you can discuss what's kind of coming out there, and bring that into the session as well. You can ask exploration questions, such as like, the card talks about seeing what is before you and your intuition speaking. How's that resonate with you, with like what we were just talking about in our session or your current life situation? I remember like in a session, and I wasn't using these cards because I didn't have them yet, but I remember asking a client about how they were anticipating an upcoming conversation, and they were like, yeah, it's great. I'm ready for it. Like, I thought I'd be freaked out about it, but I'm not. And then the card I got was trapped in fear. And I had to be like, okay, well, how does this sit with you? What's coming up on the card now? And they're like, ugh, I'm totally panicked. I'm like, yeah, okay. Totally normal too. You can also tell them that, the card is associated with the third eye chakra, which is associated with intuition and clairvoyance. How do you experience your own intuition? This is always a great question I have for clients. The card also mentions filling your being with white light. What does this white light symbolize for you personally? So these are great ways to kind of explore this a little bit more. Also, there's reflective journaling. So you can invite the client to use the provided journal prompts to further explore their projections. So an additional prompt I added was like, what truths am I currently aware of, and how can I further develop my intuitive abilities? But let's just say there's a block. There's also in the book, it says like, what can you do to lift the fog? Like really looking at like, what can we do to change the situation if someone's really feeling like, I don't feel this intuition, I'm not feeling connected. And I always say there's no good or bad, there's connected or disconnected. So how can we lift that fog? Now, it's also going to be really important for you to integrate these with the therapeutic goals. So link the insights gained from the projection exercise to the client's therapeutic goals, and discuss how their projections relate to their current challenges, desires, and areas of growth. You can ask questions like, how can the insight from this exercise help you in your current life situation? What steps can you take to enhance your intuitive abilities based on the card's message? How does the concept of clearing and drawing in a light relate to your emotional and spiritual well-being? And again, these can all be changed, but I'm just giving you a little format to follow. Then you can close up the session by summarizing the key insights and discussing any actions the client might take based on the projections, and encourage them to continue using the cards and practice for further exploration if they do have a set of their own, or maybe they want to get a deck of these so that you can have one in your office and they can have one on their own too. And some additional follow-up suggestions are going to be like, use the essential oils and crystals associated with the card during like meditation to deepen the connection to their intuition. But I also like to do this because if they're able to get their hands on the essential oil or crystal, it also connects them back to the therapeutic space. And if we can train our brain to train the brain to understand that the therapeutic space is safe, it's something that can create a bridge to that safety when they're out in their own worlds. You can encourage them to repeat the chakra mantra daily to reinforce the insights that they've gained, or they can continue journaling about their intuitive experiences or any new truths that emerge as they're kind of moving through. Okay, gave you a lot of information. So just in summary, regardless if you're using the Essential Soul Care Oracle deck, which is lovely, it's important for you to know the clinical theories that are going to align with these practices. Okay, so we went through a whole bunch of them, and doesn't mean that you need to align with every single one of these clinical theories. It just means that like, which one of these clinical theories, based on my description of them, really resonates with you and how you understand transformation happens and how you understand human behavior and experiences. So you need to know your clinical theories to remain within scope of practice, because the clinical theories are going to support the modalities, and the modalities need to be connected in order for them to fall under that clinical scope of practice. It's really important to understand the similarities among different healing modalities. So if you're using these alongside CBT or DBT or EMDR, like, I really want you to sit with it. It doesn't have to be like this hard thing where you're like, just like, okay, what does EMDR do? And what does this do that's similar? Like, just easy, acknowledge what it is, and then build that bridge from there and build that verbiage from there. Always, always, always create a complementary approach to the clinical application. So we want these types of modalities to support clinical application. And you want to be able to see how it can play out in session. unless like experiential learning is your thing and you really like want to just see how it comes up in session, I personally like to develop a relationship with whatever modality I'm bringing into the space before doing it. Um, that's just my opinion. But of course you can do what you like, but I really think that it's important for you to familiarize yourself with these practices before integrating them. Um, and it's really important for you to create verbiage and transparency and your informed consent about these practices, risks, application, what to experience, all of that. And of course, you can be innovative and unconventional and remain within scope of practice. Absolutely possible. All right. Well, thank you so much for listening to me talk about something I love. Um, and I wanted to let you know where you can gain access to me should you need. Um, I don't just talk about oracle cards, like literally, you can tell me any healing modality that you use. And my guarantee is that I can correlate it with a clinical theory and build clinical language around it because we're talking about healing. So my website is blacksheepguide.com. You can find me on Instagram. You can also email me directly if you'd like. And if you feel inclined, feel free to join my Facebook group. Like if you're looking for collaborative community, if you're looking to just get access to free resources, if you have questions for me directly, I'm in this group like all day long. I'm answering questions all day long. So please feel free to reach out that way as well. Uh, so thank you so much for participating today, and I wish you all well and lots of luck using your Essential Soul Care Oracle deck. Have a wonderful day.